My name is Nader Moazami. I'm the Surgical Director of the Heart Transplant Program and the Mechanical Circulatory Support System here at NYU Langone. The reason I decided to become a doctor is probably the large influence that my father had on me. He was a physician, and many days I would go with him to his office or to the hospital, around with him. And I think from the very beginning it was instilled in me that I wanted to be a physician. What I've really focused over the last 10 years of my career has been on surgical treatment and management of patients with heart failure. So these are patients who basically their heart is weakened to a point that they cannot support their own circulation. And we look at options that we can do after we've really exhausted every medicine that we can give to them. So a lot of the patients that I treat actually are those in whom they actually either need a device in order to be able to survive or they need a heart transplant. And that's really where my specialty has been, my focus has been, my passion has also been. And many patients do very well with medical therapy of heart failure. So really the ones that come to my attention are the ones that have had all these treatments, and there's really no other option other than transplantation. And what's really changed in the last 2 decades in heart transplantation is basically our understanding of how to treat rejection, how to select hearts that patients would not reject. And if you kind of look at the overall trajectory of improvement in survival over the last 2 decades, that's a culmination of what we've learned from transplantation. I think what really differentiates our program from many others is that we really have made an attempt to create an environment that the patients would feel extremely comfortable. At all levels of our institute, everyone really cares for the patients. It is not just another transplant for us. It's really what each specific patient needs. And I think we view everyone as if they were part of our own family. And that is what really separates us, I think, from many other medical centers. It's the level of care that the patients get throughout their entire stay here with us.